चालू करो.
Yeah, so good afternoon, everyone. I'm Dr. Raghav Nagpal, working as consultant cardiologist at SL Raheja Hospital, Mumbai. It is my privilege to introduce Dr. Haresh Mehta. He is the Director of Interventional and Structural Cardiology at SL Raheja Hospital. He is an internationally renowned cardiologist with over 25 years of experience in treating complex coronary interventions, transcatheter valve replacements, congenital heart disease, and advanced heart failure therapies. He has numerous published papers in both national and international journals to his credit. He is also the recent recipient of the Times Healthcare Excellence Award 2024. Over to you, sir.
Thank you, Raghav, for the kind words. And today we are here to discuss common health problems concerning the heart and healthy heart. So, how to keep our heart healthy? Raghav, why don't we start this?
Yes, sir. So the first question is, nowadays we see a lot of young patients presenting with heart attacks. So what could be the cause and prevention methods for this?
So, of late, I would say in the past decade or so, or maybe slightly longer, the average age of patients coming with heart disease is significantly reducing. When I was training, we had patients 65, 70 and above coming with heart disease. And by the time I started practice, it had already come down to 50s and 60s. In the last few years, I've been seeing 30s, 40s commonly, and sometimes even 20s. So that's a very disturbing trend. And what I have noticed is there are multitude of factors that contribute to it. I'm going to enlist a few. One of them is addictions like smoking. Smoking is on the rise, both in men and women. Second is addictions. Drug addictions are on the rise. Third is over the counter medicines for boosting your body. So, fat burners, supplements, which are unsupervised. So, we really do not know what they contain, whether they contain drugs that can increase the heart rate, increase the blood pressure. Fourth is significant increase in stress levels, reduction in sleep and sleep quality. And in this competitive world, everybody wants to edge ahead of the other. So they're always jostling for the same space. So they're always high strung overachievers. And on top of that, sedentary lifestyle. Either you are two spectrums, one are exercising too much and some are not exercising at all. So you have the higher incidence of young diabetics, young blood pressure patients. So all this increases the burden of heart diseases, which leads to heart diseases. Last but not the least is unsupervised bodybuilding or gymming, where they do not know their risk of developing heart issues and they take up these aggressive sports. And you've heard of people dropping dead in the gymnasium. So that also needs to be looked into. So these are the various factors that has caused the young patients to have heart disease. And I think the preventive answer lies within the question. So you have to handle stress, you have to be away from addictions, you have to have a better balanced diet, you need to sleep well, you need to stress less. So it's basically a change of lifestyle. And that can only happen when one gets aware that you need a balanced lifestyle. So you need to work at the same time you need to rest. They both have to go together. You cannot just work and no rest, and then obviously you're going to create problems. And stay away from addictions. I would say try to meditate or spend time alone for yourself every day. So when you meditate and spend time on yourself, you introspect, you realize what you are worth, what do you need to do, and that will help you change your lifestyle and reduce the risk of heart disease.
Right. Yes, sir. The second question is, what are the most effective lifestyle changes for a healthy heart?
What are the lifestyle changes? Again, it was there in the first answer, but I'm going to tell you. And in fact, I have a question from Zain who says that can you please elaborate on stress management? So stress is going nowhere, Mr. Zain. So we have to live with stress. So there's no doubt that this stress is not going to go away. So this world is not going to change for us. But we have to change to adapt to the world. So dealing with stress is one, set your goals right, know your limitations, and spend time with yourself. What I mean by spending time with yourself, every morning, spend a few minutes. or in 30 minutes, whatever you can do, sit alone in a corner, introspect, reflect, learn meditation, how to go inside yourself and interiorize. I do heartfulness meditation, it's been very good for me. So that gives you a perspective of your life and teaches you how to deal with stress. And beyond the point, learn to say no. I cannot do this. You're beyond the point if someone pushes you and you realize that I can't do this. So please find a polite way, a nice way of saying no, I cannot do beyond this point. So that's an important boundary to create. And of course, you have to learn to control your blood pressure, control your sugars. You need to follow up with your doctor. Understand your risk of developing heart disease. If you're obese, try to lose weight, get to the gym, walk a mile. So all these things and addictions, according to me, you have to quit smoking and stay away from drugs as far as possible. I would say that's the way to change your lifestyle.
Right, yes, sir. So, could you elaborate on the diet and foods considered best for a healthy heart?
Yeah. So diet and food has been taking center stage since a long time. Of course, there's a saying, you become what you eat. There's always the ancient people used to say you become what you eat. So that time when there were cannibalism, when people were cannibals, so they used to behave like cannibals. So you have to become what you eat. So I believe that the best way to eat is eat a balanced diet, which includes sufficient proteins, carbohydrates, fats. Now the question is, somebody is going to ask me what is how much protein, how much carbohydrate, how much fat, how do I know? So the basic problem with Indian population is that we are high carbohydrate eaters. So we eat a lot of sugars. When I mean sugar, people say that I don't eat sugar, but that's not true. Only sugar that you add in your tea or the sugar you put in your sweet is not the only sugar that is there in your life. So if you are having lots of carbohydrate rich foods like chapatis, rice, potatoes, sweet potatoes, some vegetables, you're having desserts, you're having off the counter cookies. All these have hidden sugars. Fruit juice, biggest supplier of sugar. False advertisement, 100% pure juice. It's all sugar. So you are consuming sugar unknowingly. So your carbohydrate intake is high. To have a healthy heart, you need a protein intake which should be high. When I mean protein, it should be 1 gram per kilogram minimum for a sedentary individual. And for an individual exercise is 1.5 gram per kilogram. So what foods contain protein? If you're a non-vegetarian, eggs, lean meats, fish. And if you're a vegetarian, you can don't eat any of these. Then you have simple sprouts, you have paneer, you have quinoa, you have nuts, and on top of that, you should eat good fat. Fat every time is not bad. So there's a worry that if I eat fat, I'm going to develop heart disease because of atherosclerosis. No, eat good fat. What are good fats? Nuts, olive oils. So select your oil. Now, there's a debate that I eat olive oil, but yet I'm getting heart disease. But see how much olive oil you're eating. Many people will eat 10 tablespoons of olive oil a day. So the quantity also matters. So the average oil intake should not exceed 2 tablespoons a day. So you need to moderate. And sugars should be the least. Of course, sugars are very vital. But eat complex sugars. Instead of fruit juice, have a fruit. Have a strawberry, have a blackberry, have a blueberry, have an apple, have a peach, have an apricot. Avoid sugary fruits. So don't go running behind a watermelon because that's going to raise your sugar rapidly, or a sitafal. I'm not saying don't have a sitafal. You just have to moderate your quantity. So protein, the building block comes first, then comes carbohydrate, which gives energy, then comes fat. So moderate your diet, modify it, balance it, and you'll be fine.
Right, yes, sir. So, it is assumed that as age increases, the blood pressure increases. Is it true? And if so, what is the ideal blood pressure?
So as age increases, our blood vessels in the heart and the body tend to become stiff because with age there is stiffness, the elasticity goes down. This can rise to raised blood pressure in adults, which is called isolated systolic hypertension. So yes, it does go up. So how do I keep my blood pressure down? One thing is lifestyle. Since you are a kid, or your parents should teach you to learn to consume food with less salt, because we are using too much salt, and look for hidden salt. Hidden salt is always available in packaged foods. All packaged foods are rich salt because they use salt as a preservative. Cookies, off the shelf food items that you select, low fat, zero fat millet biscuits. Sorry, they contain a lot of salt. So keep the salt intake layer. Second is maintain a good body weight. So you should be within your range for your age and height. Third is you have to have a balanced, stressful lifestyle. So if you're stressed, you need to bring your stress down. Avoid drugs which raise blood pressure. So again, I was telling you the fat burners raise blood pressure. Any drug that increases your heart rate is trying to make you lose weight fast has a side effect of increased blood pressure. So you have to use these lifestyles before you tend to get into taking medicines for blood pressure. So these are the measures you have to take. So there was a question how to control blood pressure apart from taking medicines. Yoga, meditation, all are very good ways of controlling blood pressure in the beginning before starting medications. But we need to be aware that medicine may be needed. So don't get scared of medicines. Try non-medical measures first. If they don't work, then you might have to go on to medicines.
Yes, sir. And sir, does sleep quality affect the heart, especially in today's day and age when getting 6 hours of sleep is also a privilege?
So sleep is the major problem that plagues the country, plagues the world actually. So I've noticed people, I would say at least 30% of the people in the entire world would be sleeping less than 6 hours a day. And more than that must be sleeping less than 4 hours a day, good quality sleep. So why are we not sleeping? We are not sleeping because we are overthinking. We want to be every place, every time. There's this concept of FOMO, fear of missing out. So we want to be there everywhere, we want to be seen everywhere, we want everything to be done, and yet we want to sleep also. So that's not possible. So you have to prioritize your night sleep. So learn to unwind yourself fast. So eat an early dinner, go to bed, say by 9:30, 10, whatever suits you, and avoid using any stimulation. When I mean stimulation, it means telephones, it means TVs, because all that light that comes out of these phones and TV sets and all, it leads to reduced sleep. Plus, it leads to increased thought. So, read a good book at night, drink a warm glass of low fat milk, unwind, spend time with your family. And I'm sure before sleeping, if you can practice some form of mindfulness or meditation, it will enhance your sleep. So, sleep is very important. Do not compromise on sleep. And if you do that, I'm telling you that 50% of your problems will be solved without seeing a doctor or without consulting a doctor for your problems. And lack of sleep, as you know, is also linked to high blood pressure, diabetes, sleep apnea, heart attacks. All of this can happen with lack of sleep.
Sir, could you discuss a few common hereditary heart issues and how to manage or prevent them?
So you're talking about which one, the hypertrophic cardiomyopathies, or you want congenital heart disease? Which one do you want?
So, hypertrophic cardiomyopathy, especially which are common in
Yeah.
adults.
So there is this sudden spurt you must have been reading in the papers or listening that XY suddenly died. A young man. He was running a marathon. He died. He was in a party. He died. He was traveling somewhere. He suddenly fell and collapsed. So these are some of these patients have a congenital problem which is called hypertrophic cardiomyopathy, wherein the muscle of the heart gets thick. They don't have high blood pressure, but their muscle is very thick. So the cavity size of the heart, which is normally slightly bigger, is very narrow in these patients. So these patients tend to have sudden cardiac death, wherein in these patients with slightest amount of exertion, you might feel giddy, you might feel blackout, and you might fall. That is because their muscles are so thick that the cavity is so small, and the cavity collapses and they are dehydrated. Second is these patients suddenly develop a condition called ventricular tachycardia, wherein the heart races so fast, it goes up to 200, 220, 240. So for a common man, you will feel the heart has stopped. The heart actually hasn't stopped. It has got so fast that you can't feel it. And this heart rate, if it is continued beyond a few seconds and it's not detected and converted back to normal, it will lead to zero blood pressure, which leads to death. And this worsens when these people exercise a lot. When you exercise too much, your muscle gets thicker and your body has less fluids when you exercise and you suddenly die. So you should be aware of this condition. This runs in families. So if you have a family history of someone in your immediate family dying suddenly in the past, so you are candidates. You should get yourself examined by your doctor before you start any major aggressive sport or a gymnasium, or you deal in any other activity like a marathon. So this is hypertrophic cardiomyopathy, which Raghav wanted to know about.
Right. And also, what are the early signs of heart attack?
So how do I know that I have heart attack, or how do I know that will I get a heart attack? So there are something called as risk factors for heart diseases. So we all should be aware what are risk factors for heart disease. So if you are an individual, say 25 years old, and you want to know what is your chance of getting a heart attack. So you need to meet your doctor, any doctor, it's any physician, or you can even go on international or national medical sites. They'll give you all the risk factors leading to heart diseases. So you have to score yourself. So the factors go as diabetes, family history, or whether you have it. Blood pressure, family history, or whether you have it. Do you have parent, a male less than 60 who's died of heart disease or had a heart disease at less than 60, or mother who's had a heart disease at 65 or less? Then, if you are high type A personality where you're always active, do you have addictions? Do you have any other comorbidities like kidney disease? Whether your cholesterols are normal, whether your blood pressures are normal. So, all of this will tick and they give you a score. And then in the end of the table, there's a score down, which will tell you that based on this score, you have a 10% chance, or a 15% chance, or a 20% chance of developing heart disease in the next 10 years. So, with that, you know that you are someone who is at risk of heart disease. So, once you know this, then is the time you need to address it immediately. So you need to go to your doctor, check your blood levels, check your sugars, check your cholesterol, check your blood pressure, check your weight, and correct each one as possible. What is in our hands, we can correct. We cannot change our parents, we cannot change our genes. So that risk factor we cannot change. So once we know these risk factors, we can start acting on these risk factors and try to minimize our chance of developing a heart attack. Now the question is, how do I diagnose a heart attack? How do I know whether I'm getting a heart attack or not? So, if you get any compressive feeling in your chest, as if someone is holding a rubber band, you feel someone is sitting on your chest, is not relieving it, and this pain tends to radiate to your jaw or to your shoulder on the left, generally left, although it can go on to the right. It can radiate down your arm. It can also mimic a gas. You feel that burpy feeling, and the moment you rest, the burpy feeling goes down. You start sweating a lot. This is a time to know that something is wrong. I'm not saying this is heart attack, but these are signs pointing towards a heart attack. Whenever you get some of these signs, please go to the nearest hospital, get an ECG done, see a doctor. He will tell you whether it is gas, whether it is heart attack, whether it's high blood pressure, whether it is gallbladder problem. Let him diagnose that this is not heart attack and this is gallbladder or this is gas or something. You do not diagnose, because the commonest mistakes people make is to wait at home and think this is gas. So they have Gelusil, and someone will have Digene, and someone will suggest you have Pudinhara, and they waste a lot of time. Because heart attack patients, the golden hour is very important. They have to reach within 1 hour to the hospital and get their vessel opened if it is blocked. So do not waste time thinking at home what to do, what not to do, and get to the hospital.
Right. Yes, sir. And so, what are the effects of smoking and alcohol on heart health?
Okay. Smoking is one addiction that I can tell you that will leave no person spared of disease. Not a single one. It affects each and every organ of your body because it leads to deposition of cholesterol, atherosclerosis in all the blood vessels, right from your heart to your neck vessels supplying the brain, to the blood vessels supplying your intestines, to the blood vessels supplying your kidneys, to the blood vessels supplying your lower legs. All of these will develop calcium and cholesterol deposition, leading to atherosclerosis. And if it spares any of this system, it will get hold of your lung, give rise to lung diseases, give rise to lung cancer, gives rise to prostate cancer, gives rise to colon cancer. Name the cancer, name the heart disease that smoking causes. You will be surprised that each and every organ of your body can be affected by smoking. So, smoking is an absolute no no, it is a zero. It should never be encouraged. And another thing to remember is that smoking cannot be reduced. So do not keep fooling yourself that I'm going to reduce smoking from 20 to 15 and then to 10 and then to 5 and I'll stop. Smoking has to be stopped immediately if you want to live a healthy life. Coming to alcohol, alcohol is a very debatable issue. Some people will tell you drink alcohol is good for the heart. So let me tell you a simple funda in this. If you drink sparingly, drink 30 to 60 ml, it will help keep your heart healthy by antioxidants if you are drinking. If you have not had alcohol ever, please do not start alcohol because starting alcohol does not prevent heart diseases. So that's a misconception people need to get very clear. Do not start alcohol to prevent heart diseases because alcohol itself can lead to heart diseases by a condition called alcoholic cardiomyopathy. It can lead to increased blood pressure. It can lead to a very fatal condition over time, which is called atrial fibrillation, where the heart rate becomes fast. It doesn't kill you, but that atrial fibrillation leads to clot develop in the heart, which can dislodge and go to the brain and give you a massive stroke or paralysis. So alcohol on its own is not good at all. So please do not start alcohol to prevent any disease. Huh, but you've been drinking for a long time, you find it difficult to go off alcohol, then at least minimize it to 30 to 60 ml. Do not be a binge drinker. A binge drinker is not good either. So there was a saying that people say that alcohol is good for the heart. So if you look at alcohol patients, coronary arteries, the heart disease patients, the arteries look very clean, but more than half of them or die with cirrhosis of liver. So there is somewhere else that alcohol will catch you. So do not get into these addictions if you can avoid them.
Yes, sir. Sir, is it true that once a person starts medications for blood pressure and cholesterol, it is lifelong?
Okay. Again, a common problem we face in our country that people are very scared of starting medicines. And you ask them why, so they say side effect होता है. तो ऐसे क्या साइड इफेक्ट होता है? तो someone will say कि खांसी होती है, someone will say मेरा किडनी खराब हो सकता है, someone will say कि मेरा पैर में सूजन आता है. I ask them a simple question कि जब आप स्मोक करते हो तब सोचते हो कि स्मोकिंग का साइड इफेक्ट क्या होगा? I've already told you so many bad effects of smoking, but nobody cares about that. They will not quit smoking. I'll tell them ki if you eat 10 samosas a day, what is that samosa going to do into your body? It will give you diabetes, it will give you high blood pressure, it will give you cholesterol, it will lead to heart disease. Will you stop samosa? They'll never say that. But the moment you give them a pill to take his pressure down, or take his cholesterol down, or take the sugar down, sir, ये बंद हो जाएगा. Do I need to take it for a lifetime? How many people have died of taking a blood pressure medicine versus how many people have died of not taking a blood pressure medicine? So, not taking a blood pressure medicine will lead to bleeding in your brain, stroke. You may be paralyzed for life, dependent on other people all your life. You may not get death, but you may have a very bad life. Whereas taking one pill for blood pressure will keep the blood pressure down. And maximum what it will cause? It will cause swelling of your feet, or you'll get some cough. There are very rare patients will die due to side effects of drugs unless you are unsupervised. So you're not following up with a doctor and taking drugs indiscriminately on your own. Then it can cause problem. Now, answering the question whether you become to take it for life or not, it all depends on you. If you manage your lifestyle well, if you manage to get your blood pressure down, sugars down with a very good lifestyle and maintain it down with lifestyle, why would a doctor want to give you medicine? He's not interested. His aim is to get your pressure at a level where he wants it every day. So your pressure has to be at that level every time you see the doctor or every time you're at home. So there's the sugar, so is the lipid. So you manage with good lifestyle. Why would anybody want you on medicines? So it's a misconception. It cannot stop. Stopping or starting depends on you, not on the. Bear that in mind. You are the one who will decide whether you can go off. There's some Mr. Vijay Gupta has a couple of questions. You want to read that, Raghav? Do you have it in front of you?
Uh, yes, sir. Yes, sir. How to control blood pressure apart from taking medicines? And is asked that I'm having a desk job and end up sitting for 7 to 8 hours plus traveling 2 hours. This gives a sedentary lifestyle. What can I do?
So everybody in Mumbai is probably working 8 hours, traveling 2 hours. So you have to compromise in some form. So you get up early, sleep early, get up early, go for a quick 30-minute brisk walk, or do a 30-minute exercise at home, and then leave the home. And if you're staying away from the station, take a brisk walk to the station rather than taking a cab or a car. And wherever you're working, if there's a gymnasium available, use it. If it's not, climb stairs. So if your office is on third floor, climb it 2-3 times. So lots of exercise can be incorporated while you're working. And there's something called a desk yoga. You must have heard of it. So people can do yoga sitting on the desk on a chair for 10 minutes. So all these things are available to you to learn, to see, and surely you can manage this within the time you have. It's all about prioritizing yourself versus prioritizing your work. If you are alive, you'll be working. If you're not alive, who's going to work? So that's the thing you have to realize. Yes, I am available on social media platform. I'm there on Instagram. I'm there on Facebook, and I'm regularly posting from SL Raija Hospital. You can follow SL Raija Hospital, and you'll be able to get through to me. And if you search me on Facebook or Instagram or YouTube, you'll find me. So we regularly want to give tips to people to get healthy, be healthy.
So, and how often should one do a complete health checkup? And what is the role of CT coronary angiography in it?
Okay. So complete health checkup again should not become a norm. Unfortunately, people have been doing health checkups indiscriminately, going to a hospital getting a health checkup done. Health checkup has to be prioritized. And how do you prioritize health checkup? First, the doctor has to record your history to know what checkup do you need. So if you have a significant family history of heart disease, then you should target checkups in that direction. And if you have a strong family history of recurrent cancer, then the target should be looking towards cancer. So there, one size doesn't fit all. So I think health checkups should be individualized; they should not be general. And unfortunately, it has become general. So you'll have find patients coming with you with a CT angio. So all of them have undergone a CT angio and come to you and say, now doctor, what do I do? So CT angio, according to me, has to be prescribed by a cardiologist, whether you need it or not. Because try to understand when you do a CT angio, the first thing you need to know is why are we doing it? So if you're a low risk individual, so suppose you're a 30-year-old man whose sugars are good, whose blood pressure is good, whose cholesterol is good, whose family history is negative, he has nobody in the family who's got heart disease, he's super fit, regularly exercising, good weight. Why does he need a CT angio? And then he comes with a CT angio. And there are people who are diabetic, high blood pressure, high sugars, bad kidney, again get a CT angio done, which is again not good because a bad kidney, if you do a CT angio, you'll worsen your kidney. So it cannot be decided by a marketing person sitting in a hospital telling you that this is the package for you. No. Select the package as per your doctor. So do not go for any test unless your doctor tells you to do A, B, C, D, E, F. That's my take on CT angio. Brilliant tool for preventing and finding out whether the risk of heart disease is and how do I treat it, but grossly misused, both underused and overused. In some places where it should be used, is not used at all, and in places where it should not be used, is used a lot. So that's my take on CT angio. Please let your doctor decide, a cardiologist decide whether you need a CT angio.
It was a wonderful session, sir. I want to thank sir for his valuable insights and sharing his extensive knowledge with us.
Thank you, Raghav, and thank you, viewers. And if you feel that you need any more questions, I'm sure you can drop in messages on this chat box, and also you can write to SL Raja Hospital. We will answer your queries back, and wish everybody a healthy heart.
Thank you, sir.
Thank you.